if you're going to understand something as big as addiction, you got to get in close. You got to get into the trenches.
During this pandemic, our nation experienced the highest number of overdose deaths ever recorded in a 12-month period. Taking action to expand access to safe and proven treatments could not be more urgent.
Harm reduction is a methodology. Like, how are we going to approach drug use and substance use, et cetera, with a compassion and, from a science or evidence-based perspective. But simultaneously, it's also a worldview, a political orientation that keeps centering the humanity of people.
It helps reduce the number of new HIV infections. It helps reduce the number of hepatitis C infections and hepatitis B. It helps reduce the number of cases of endocarditis and sepsis that just overwhelm our healthcare system. You want to help remove the burden on the United States healthcare system? Put money in harm reduction.
If you showed up to a hospital with a heart attack, you would be started on 6 new medications immediately for the rest of your life. There would be not a question about if you would stay on those medications, for how long, to prevent you from having another heart attack. It's a near-death experience, and yet in this day and age, we have highly effective medications. It breaks my heart that people for a chronic condition like opioid use disorder are not accessing methadone and buprenorphine for as long as they need.
You see somebody strung out who's stealing, they're in chaotic use, they'll steal your last $2 just to try to go get a hit. Whenever they're sober or clean, whatever, some of the greatest people in the world, some of the smartest people in the world.
There are those people who I work with and deal with who take the attitude that why do you care? Why are you trying to save these people that you work with? And my response to that is simply, as long as there's life, there's hope.